Welcome to Dermatology Lecture Series. Today we discuss about the secondary changes that modify the primary lesions. For example, scale, crust, erosions, ulcers, atrophy, etc. Scale and crusts occurs due to collection of cells or exudate. Scale is a flake formed by collection of cells of horny layer of the skin, and removal of scales reveals a dry surface. Here is the image showing silvery scales in psoriasis. Crust is a collection of dead epidermal cells, dried serum and sometimes dried blood. It is yellow to brown in color. Crusts may be easily removable as in impetigo or adherent as in eczema. Removal of crust reveals a moist surface. Here is the image showing honey-colored crust of impetigo. Due to loss of continuity of skin, we have erosions, ulcers, fissure, sinus and excoriation. Erosion is due to complete or partial loss of viable epidermis with no or minimal loss of the dermis. Ulcer is a loss of epidermis and at least upper dermis, though sometimes ulcer may extend into the deeper tissues. And fissure is a slit in the epidermis. Then sinus is a blind track in skin. Opening of the sinus should be examined as it may give a clue to diagnosis. And then excoriation as linear erosions formed when skin is scratched. This is the diagram showing erosion, ulcer, fissure, excoriation and atrophy. Next about atrophy. Atrophy means thinning of skin which may be due to atrophy of epidermis, dermis or subcutaneous tissue. Epidermal atrophy manifests as thin, shiny skin, which may crinkle like cigarette paper and may show loss of surface markings. For occult leprosy, dermal atrophy clinically manifests as an area of depressed skin and it may be possible to invaginate a finger in the depressed skin. Lichenification is the response of the skin to repeated scratching and it manifests as thickening of the skin, hyperpigmentation and increased skin markings. Example lichen simplex chronicus and atopic dermatitis. In scars, normal structures of skin are replaced by fibrous tissues, which is not laid in an organized fashion. The normal skin markings are hence lost in a scar. Scars are of two types, atrophic scars and hypertrophic scars. Atrophic scars are characterized by loss of tissue and hypertrophic scars are characterized by increase in fibrous tissue. This is the image showing atrophic scar in acne vulgaris and hypertrophic scar of keloid. Sclerosis is diffuse or circumscribed in duration of dermis or subcutaneous tissue, for example lichen sclerosis. Thank you for watching. If you like the video, feel free to like and share. And subscribe to our channel for more lecture videos.